What are the primary considerations when combining behavioral medication with behavior therapy for animals, and how does the timing of medication use affect behavioral interventions? Answer: when combining behavioral medication with behavior therapy, it is essential to ensure that the two approaches complement each other rather than interfere with one another. The key considerations include timing of medication. Medications such as SSRIs, selective serotonin reuptake inhibitors, or benzodiazepines should ideally be administered in a way that maximizes their effectiveness in conjunction with behavior therapy. Medications are typically used to address underlying physiological issues that may be affecting the animal's ability to engage in behavioral learning, anxiety or compulsive behaviors. Sequencing. Behavioral interventions may be more effective once medication has begun to take effect, as the animal may experience reduced anxiety or improved mood. Timing should account for the half-life and peak action of the medication to synchronize with therapeutic sessions. Monitor side effects. Side effects may interfere with behavioral modification efforts, such as sedation or lethargy from anxiolytics, which can reduce the animal's responsiveness during training sessions. These effects should be carefully monitored. Why is active listening critical when communicating with clients about their animal's behavioral issues, and what are the core techniques that should be applied during these conversations? Answer: active listening is a fundamental technique that builds trust and rapport with clients. It involves fully concentrating, understanding, responding, and then remembering what the client says. This ensures that the client feels heard and understood, which is vital in any counseling situation, especially in managing behavioral issues in animals. Core techniques of active listening include reflective listening, repeating or paraphrasing what the client says to show understanding and encourage further elaboration. Clarification, asking open-ended questions or making statements like, "Can you clarify what you mean by?" to ensure that both the consultant and client are on the same page. Nonverbal cues, nodding, maintaining eye contact, and using body language to express attentiveness. This approach helps the consultant gather accurate information regarding the behavior, which is essential for formulating a successful intervention strategy. It also aids in educating the client, making them more receptive to the behavioral change process. When evaluating the effectiveness of pharmacological interventions on animal behavior, what are the key behavioral and physiological feedback mechanisms that should be monitored? How do these inform the decision to continue, modify, or discontinue medication? Answer: evaluating the effectiveness of pharmacological interventions requires continuous monitoring of both behavioral and physiological feedback from the animal. Key mechanisms to track include behavioral feedback, observations of changes in the animal's behavior, e.g., reduction in aggression, anxiety, or compulsive behaviors are primary indicators. The animal's responsiveness to behavior modification strategies also informs the effectiveness of the medication. If the animal's behavior improves in response to therapy, it suggests that the medication is having a positive impact. Physiological feedback, monitoring vital signs such as heart rate, blood pressure, and general physical well-being can help detect side effects. For example, if an anxiolytic causes lethargy or changes in appetite, this could indicate a need for adjustment. The decision to continue, modify, or discontinue medication should be based on both the behavioral changes observed and any adverse effects reported. If the animal shows improved behavior with no significant side effects, the treatment may be deemed effective. However, if side effects are severe or the behavior does not improve, adjustments may be needed either by changing the medication or altering the dosage. Mr. Thompson has been struggling to manage his dog's separation anxiety and frequently calls you with questions about how to proceed. He expresses that his dog's anxiety is making it difficult to leave the house and he's growing frustrated. What steps should you take to manage Mr. Thompson's expectations, educate him on the treatment process, and provide him with actionable steps? Answer: in this scenario, managing expectations and educating Mr. Thompson is critical to ensuring that he remains engaged in the process. The steps you should take include: build trust and rapport. Empathize with Mr. Thompson's frustration by acknowledging the challenges of managing separation anxiety in dogs. Show that you understand his concern. Educate and explain the process. Explain that behavioral issues like separation anxiety often take time to address and the improvement may not be immediate. Provide an overview of the typical process, which includes behavior modification techniques such as desensitization and counter-conditioning, combined with possibly using pharmacological interventions. Set realistic goals. Help Mr. Thompson set small incremental goals, such as increasing the duration of time the dog is left alone or practicing short separations. Emphasize that behavior change requires patience and consistent effort. Actionable steps. Offer practical actionable steps like starting with short departures, gradually increasing the time spent away from the dog, and reinforcing calm behavior when returning. Suggest a training schedule and provide reassurance that progress may be slow but will come with consistency. What are some common side effects of medications such as SSRIs or anxiolytics used in animal behavior management, and how can practitioners manage these risks effectively while ensuring the safety of the animal? Answer: medications like SSRIs and anxiolytics are often prescribed to manage anxiety-related behaviors in animals. Common side effects include SSRIs, e.g., furosemide. Side effects may include gastrointestinal disturbances, vomiting, diarrhea, lethargy, and changes in appetite. In rare cases, more serious side effects such as serotonin syndrome, agitation, tremors, increased heart rate can occur. Anxiolytics, e.g., diazepam, gabapentin. These medications can cause sedation, loss of coordination, and incoordination. Long-term use may lead to dependency or withdrawal symptoms if discontinued abruptly. To manage these risks, close monitoring. Regularly assess the animal for signs of adverse effects. Initial doses should be low and gradually increased. Observing the animal's response. Educate the client. Clients should be educated about potential side effects, and they should know when to contact the consultant if any adverse reactions occur. Alternating medications. In some cases, the animal may need to switch medications or use adjunctive therapies, e.g., behavioral therapy, supplements if side effects are unmanageable. How is it important to set realistic goals for behavior modification in animals, and how can you help clients set goals that are both achievable and effective in creating long-term behavior changes? Answer: setting realistic goals is critical to prevent client frustration and to ensure that behavior modification efforts are both effective and sustainable. Goals that are too ambitious may overwhelm both the client and the animal, leading to setbacks and discouragement. Effective goal setting involves a specificity. Define clear, measurable behaviors that can be tracked over time, e.g., the dog will remain calm for 10 minutes after the owner leaves the house. Achievability. Break down long-term goals into smaller, incremental steps that the animal can realistically achieve. This allows for small wins that help maintain motivation. Timeline. Provide clients with a reasonable timeline for expected progress, emphasizing that behavior modification can take weeks or months, depending on the severity of the issue. Setting achievable goals helps manage expectations and encourages clients to remain committed to the process, which is essential for successful long-term behavioral change. What are some common adverse reactions to behavioral medications, and how should a behavior consultant respond if an animal experiences these reactions? Answer: adverse reactions to medications like SSRIs or anxiolytics are not uncommon and should be carefully monitored. Common reactions include behavioral changes. Agitation, aggression, or a worsening of the initial symptoms may occur as the body adjusts to the medication. Physical side effects. Vomiting, diarrhea, sedation, or changes in eating and drinking habits can occur with certain medications, especially SSRIs and anxiolytics. A behavior consultant should monitor closely, stay in regular communication with the client to assess the animal's condition. If any severe reactions occur, such as extreme sedation, lack of coordination, or behavioral aggression, the consultant may need to recommend discontinuation or a reduction in dosage. Coordinate with a veterinarian. If severe side effects are observed, the consultant should encourage the client to consult with the prescribing veterinarian to adjust the medication or explore alternative treatments. How do pharmacological interventions for behavior modification differ when applied to special populations, such as elderly animals or those with coexisting health conditions? Answer: special populations, such as elderly animals or those with other medical conditions, e.g., kidney disease, diabetes, require careful consideration when prescribing pharmacological interventions for behavior modification. Elderly animals, age-related changes, such as reduced liver function, may affect how medications are metabolized. Lower dosages or medications with fewer side effects should be considered. Additionally, cognitive dysfunction syndrome (CDS) may require a different treatment approach. Animals with coexisting conditions. Conditions like heart disease or kidney failure may influence medication choices. For example, anxiolytics that are metabolized through the liver or kidneys should be used cautiously, and medications with minimal drug interactions should be prioritized. In these cases, a behavior consultant should work closely with the animal's veterinarian to ensure that medications are safe and appropriate for the animal's health status. Samantha is a first-time dog owner who is struggling to address her dog's fear of loud noises. Her dog becomes highly anxious during thunderstorms, and Samantha is unsure how to proceed. What steps should you take to guide Samantha in managing her dog's fear, and how can you help her build realistic expectations? Answer: to guide Samantha in managing her dog's fear, follow these steps. Assess the situation. Begin by understanding the specifics of the dog's behavior during thunderstorms, e.g., trembling, hiding, vocalizing. This allows for a tailored intervention. Educate the client. Explain that it's common for dogs to fear loud noises, and such issues typically require gradual desensitization techniques. Introduce counter-conditioning strategies, such as pairing the sound of thunderstorms with positive reinforcement, e.g., treats or toys. Set realistic expectations. Emphasize that change will take time. Achieving progress might involve several months of consistent practice, so managing her expectations is crucial to avoid discouragement. Safety measures. Recommend creating a safe space for the dog during storms and using products like anxiety wraps or pheromone diffusers to reduce anxiety. What are some potential drug interactions that can affect the efficacy of behavior-modifying medications in animals, and how should consultants manage these interactions to ensure safe and effective treatment? Answer: drug interactions can significantly affect the efficacy and safety of behavior-modifying medications. Common interactions to be aware of include SRI and MAOI interactions. Monoamine oxidase inhibitors MAO can interact with SRS, leading to serotonin syndrome, a life-threatening condition characterized by agitation, fever, and muscle rigidity. It is crucial to ensure that SRIs and MAOs are not used together. Benzodiazepines and other sedatives. Combining benzodiazepines with other sedative medications, e.g., barbiturates or opioids, can enhance sedative effects, leading to dangerous sedation or respiratory depression. Drugs metabolized by the liver. Many behavior-modifying drugs are metabolized by liver enzymes cytochrome P system. Medications that inhibit or induce these enzymes can alter the metabolism of other drugs, affecting their effectiveness or causing toxicity. To manage these interactions, consultation with a veterinarian. Always ensure that the prescribing veterinarian is aware of all medications the animal is taking, including over-the-counter drugs, supplements, and any behavioral medications. Adjust dosages. In cases where drug interactions are suspected, dosages may need to be adjusted, or alternative medications should be considered. Regular monitoring. Monitor the animal for signs of adverse reactions, particularly when new medications are introduced or the animal's health status changes. What are the key physiological markers of stress in animals, and how can these markers help assess the animal's welfare during a behavioral consultation? Answer: key physiological markers of stress in animals include cortisol levels, heart rate variability (HRV), and respiratory rate. Elevated cortisol indicates the presence of stress, as it is a hormone released in response to physical or emotional stresses. HRV is a measure of the autonomic nervous system, where low variability suggests the animal is under distress and unable to adapt effectively. Monitoring HRV can reveal whether an animal is in a constant fight or flight state. Respiratory rate and heart rate can also provide immediate feedback on stress levels. These markers help behavior consultants assess an animal's welfare by providing objective data that complements behavioral observations. For instance, increased cortisol may suggest chronic stress due to an aversive environment or lack of enrichment. By measuring these physiological markers, consultants can make informed decisions about whether behavioral interventions are needed or if environmental factors need to be addressed. The 5 Freedoms of Animal Welfare guide ethical treatment, requiring the reduction of stress to improve animal welfare, and physiological assessments support this process. Differentiate between ethical training practices based on the humane hierarchy of training methods and those that violate these principles. Answer: the humane hierarchy of training methods promotes using the least intrusive and minimally aversive methods to modify animal behavior. It starts with addressing the animal's basic needs, such as health, nutrition, and enrichment. The next step is to use positive reinforcement, rewarding the animal for desired behaviors. Differential reinforcement, such as rewarding calm behavior and ignoring unwanted behavior, comes next. Negative punishment, which involves removing rewards to reduce undesired behaviors, is used after more positive methods. The hierarchy ends with the most intrusive methods like negative reinforcement or positive punishment, but only when all other methods fail. In contrast, ethical violations occur when training relies on aversive techniques, e.g., shock collars or choke chains, without exhausting less intrusive methods. These techniques can cause harm both physically and psychologically, undermining the animal's welfare. According to the Animal Welfare Act and IAABC Code of Ethics, consultants must prioritize the animal's well-being and avoid unnecessary suffering. In this context, the LIMA principle underscores the importance of using the least intrusive methods available to achieve training goals. MS Patel's dog Bruno exhibits excessive barking whenever left alone. MS Patel has read online about using a shock collar to stop barking. Bruno shows signs of anxiety, including pacing and drooling when alone. What approach should MS Patel's consultant take and why? Answer: the consultant should advise MS Patel against using a shock collar, as it can exacerbate Bruno's anxiety and is harmful in the long term. The first step should be to assess the cause of Bruno's barking. Likely, Bruno is suffering from separation anxiety, which is characterized by distress. When left alone, the consultant should focus on desensitization. Gradually increase the time Bruno is left alone, starting with short periods and slowly building up to longer durations. Counter-conditioning: pair the experience of being left alone with positive experiences such as treats or toys to reduce anxiety. Environmental management: alter Bruno's environment to minimize stressors, e.g., moving him to a quieter area or using calming aids like pheromone diffusers. Owner education: teach MS Patel how to create predictable routines for Bruno and manage his anxiety through positive reinforcement. Using a shock collar would go against the humane hierarchy of training methods and violate the LIMA principle, leading to more harm than good. Addressing the underlying issue of separation anxiety through ethical, less intrusive methods aligns with animal welfare laws like the Animal Welfare Act. Explain the difference between animal rights and animal welfare and their implications for behavior consultants. Answer: animal welfare focuses on ensuring that animals are treated humanely with an emphasis on reducing suffering and ensuring their well-being. This approach acknowledges that animals may be used by humans provided they are treated ethically. It is grounded in the 5 freedoms, which guarantee animals freedom from hunger, discomfort, pain, injury, and fear, along with the freedom to express normal behavior. Animal rights, on the other hand, posits that animals have inherent rights, including the right to live free from human exploitation. This philosophy advocates for the abolition of animal use in all human activities, including training, breeding, and entertainment. For behavior consultants, these perspectives shape their practice. Consultants working within the welfare framework may help modify behaviors within ethical and humane boundaries, while those adhering to rights-based perspectives may choose not to work in environments where animals are used for entertainment or labor. Laws like the Animal Welfare Act focus on animal welfare, providing the legal structure that consultants can use to ensure their methods align with ethical standards that prioritize the animal's well-being over other interests. How does anthropomorphism hinder effective behavioral consultation, and how can consultants avoid this bias? Answer: anthropomorphism involves attributing human characteristics, emotions, or intentions to animals, which can lead to inaccurate interpretations of their behavior. For instance, assuming a dog is jealous because it growls when another dog approaches, the owner may overlook the dog's natural instincts or territorial behavior. This misinterpretation can result in ineffective or harmful interventions. Consultants can avoid anthropomorphism by focusing on ethological principles and observing animal behavior in context, using scientific understanding of species-specific needs, employing evidence-based practices and behavioral science to inform decisions rather than relying on subjective interpretations, educating clients on the pitfalls of anthropomorphism, emphasizing the importance of understanding animal behavior from a biological and instinctual perspective. Avoiding anthropomorphism ensures that behavioral interventions are based on objective data and not skewed by human-like assumptions, which could otherwise hinder the welfare and behavioral progress of the animal. Why is consistency in owner handling critical for successful behavior modification in animals? Answer: consistency in owner handling is critical because it creates a clear and predictable environment for the animal. Animals rely on consistency to understand cause and effect relationships between their behavior and the consequences. For example, if a dog is rewarded for sitting, but only sometimes it becomes confused about which actions lead to positive outcomes, inconsistent handling can cause confusion. Animals may not understand what is expected of them. Frustration: inconsistent reinforcement can lead to anxiety or aggression as animals struggle to interpret their owner's actions. Behavioral regression: inconsistent application of rules and boundaries may cause behavioral issues to reemerge. From a scientific perspective, operant conditioning highlights that consistent reinforcement schedules are essential for behavior acquisition and maintenance. Inconsistencies can undermine progress and may even cause the animal to revert to undesirable behaviors. Mr. Lopez's parrot, Coco, has started plucking feathers. Coco is housed in a small cage near a window and receives minimal interaction. Mr. Lopez feeds Coco but rarely changes enrichment items. What steps should Mr. Lopez take to address the issue? Answer: Mr. Lopez should first address Coco's environmental and social needs to reduce stress and boredom, which are likely contributing to the feather plucking behavior. Steps include increase cage space, ensure Coco has enough space to move, stretch wings, and engage in natural behaviors. Environmental enrichment: Provide a variety of stimulating toys and perches to keep Coco mentally engaged. Rotating toys and adding novel items regularly helps prevent boredom. Increase social interaction. Increase the amount of positive interaction with Coco, such as daily playtime and training sessions. Diet and health check. Ensure Coco is receiving a balanced diet and rule out any underlying medical conditions contributing to feather plucking. By focusing on environmental enrichment and social needs, Mr. Lopez can address the root cause of the behavior rather than relying on punitive measures. This approach is consistent with the 5 domains of animal welfare, which emphasize addressing behavioral issues through non-aversive methods that improve the animal's quality of life. What are the ethical considerations when balancing client expectations with animal welfare? Answer: balancing client expectations with animal welfare requires behavior consultants to maintain professional integrity while addressing client concerns. Ethical considerations include adherence to the humane hierarchy of training methods. Consultants should prioritize the animal's well-being over client pressure to use quick or punitive methods. Educating clients. It is the consultant's responsibility to inform clients about the most effective and humane methods, even if they are less convenient or require more time. Transparency and honesty. Consultants must set realistic expectations, ensuring clients understand that meaningful behavior change takes time and patience, and animals' welfare first. According to IAC's Code of Ethics, the welfare of the animal must always come before the desires of the client, ensuring the use of ethical training practices. By navigating these ethical challenges, consultants can align with professional standards and promote both client satisfaction and animal welfare. How can a behavior consultant ensure they are staying informed about new research in the field? Answer: to stay informed, behavior consultants should engage with peer-reviewed journals and attend conferences to learn about the latest research and techniques in animal behavior science. Join professional organizations such as the International Association of Animal Behavior Consultants (IALC) or Association of Pet Dog Trainers (APT), which offer access to resources, networking opportunities, and professional development. Participate in webinars and workshops to continue education on new methodologies. Collaborate with other professionals, including veterinarians and animal welfare experts, to exchange knowledge and stay current on best practices. By actively seeking knowledge and engaging in continuous learning, consultants ensure they apply the most effective evidence-based techniques in their practice, promoting the best outcomes for both clients and animals. What are the primary responsibilities of a behavior consultant when working with clients and animals? Answer: the primary responsibilities of a behavior consultant include assessing the animal's behavior, conducting thorough assessments to identify the root causes of behavioral issues, developing individualized behavior plans, creating plans that are tailored to the animal's specific needs based on sound behavioral principles, educating clients, teaching owners about positive reinforcement techniques and guiding them in applying behavior modification plans consistently, ensuring animal welfare, prioritizing the animal's well-being by using humane and effective methods, providing ongoing support, offering continued guidance and making adjustments to behavior plans as needed to ensure progress. These responsibilities ensure that consultants provide professional, ethical, and effective services that improve the relationship between clients and their animals while prioritizing animal welfare at all times. Differentiate between redirected aggression and fear-based aggression in animals. Provide examples to illustrate your explanation. Answer: redirected aggression occurs when an animal's aggressive behavior is directed at a target that is not the original cause of the aggression. This happens when an animal becomes frustrated or agitated by an unattainable stimulus and redirects its aggression to another nearby individual or object. For instance, a dog may bark and lunge at a squirrel outside a window, but if it cannot reach the squirrel, it may bite a nearby human or another dog. Fear-based aggression, however, arises when an animal feels threatened and displays defensive behavior. This form of aggression is not about domination, but about protecting oneself from perceived harm. For example, a dog that was abused or has had a negative experience with a person might growl or snap when approached. Fear-based aggression is often accompanied by signs of anxiety such as cowering, lip licking, or avoidance. The key difference lies in the motivation. Redirected aggression stems from frustration and inability to access a target, whereas fear-based aggression is a defensive reaction to a perceived threat. Explain the step-by-step process to treat thunderstorm phobia in dogs using desensitization and counter-conditioning. Why is consistency critical in this treatment? Answer: treating thunderstorm phobia typically involves a two-pronged approach: desensitization and counter-conditioning. Desensitization begins with exposing the dog to a stimulus, thunderstorm sounds at a low, manageable level. For example, play recorded thunderstorm sounds at a very low volume while the dog is calm. Gradually increase the volume over time while ensuring the dog remains relaxed. The goal is to desensitize the dog to the sound, reducing the emotional response. Counter-conditioning involves pairing the stimulus, thunder sounds, with positive reinforcement like treats or play. Over time, the dog learns to associate thunderstorms with something pleasant, reducing fear. Consistency is critical because phobias are deeply ingrained emotional responses. If the dog is occasionally exposed to the stimulus in an uncontrolled manner, e.g., during a real thunderstorm, it can reinforce the fear rather than diminish it. Consistent, gradual exposure helps retrain the dog's emotional response, turning fear into calmness through positive experiences. Why is the neonatal period critical for the development of reflexes in puppies, and how does maternal influence play a role during this stage? Answer: the neonatal period, birth to 2 weeks, is critical for developing essential reflexes such as sucking and rooting, which are vital for survival. During this stage, puppies are entirely dependent on instinctual behaviors to find nourishment and warmth. Their nervous system is still immature, so they rely on these reflexes to respond to environmental stimuli. Maternal influence plays a pivotal role in shaping early development. A mother's grooming behaviors stimulate physical functions like urination and defecation, which are essential for health. Her presence provides comfort and safety, crucial for reducing stress and facilitating proper neural growth. Additionally, puppies are exposed to various sensory stimuli through interactions with their mother, helping them develop sensory processing skills. If maternal care is inadequate or absent, puppies may struggle with developmental delays and stress regulation, affecting their ability to adapt to new environments or situations. Behavior consultants must recognize these early developmental stages when assessing puppies, especially those from inadequate early life experiences. What are the risks associated with oversocialization in puppies, and how can this be mitigated during puppy classes? Answer: oversocialization in puppies occurs when they are exposed to excessive stimulation or interactions without adequate rest, leading to stress or behavioral issues. Puppies need time to process experiences and develop coping mechanisms, so too much socialization can overwhelm them. This can result in overarousal anxiety or fear-based reactions to unfamiliar situations. To mitigate oversocialization in puppy classes, it is essential to monitor stress levels by watching for signs of anxiety, such as excessive panting, trembling, or retreating. Limit the duration and intensity of socialization, gradually increasing exposure as the puppy gains confidence. Incorporate structured rest periods within the class to allow the puppy time to recover from interactions. Focus on quality over quantity of interactions, ensuring each exposure is positive and controlled. A well-structured puppy class should balance socialization with individual attention, allowing puppies to adjust at their own pace. This approach ensures healthy development and prevents negative associations with new experiences. Sarah has a 5-year-old Labrador Max, who becomes highly anxious and destructive whenever she leaves for work. Sarah has tried leaving the TV on and giving Max chew toys, but the behavior persists. What steps should Sarah take, and why? Answer: Max's behavior suggests separation anxiety, which requires a comprehensive treatment plan. Sarah should take the following steps: identify pre-departure cues, observe and eliminate cues, e.g., putting on shoes, picking up keys, that signal Sarah's departure. These cues may trigger Max's anxiety. Counter-condition pre-departure cues. Practice these cues without leaving, gradually desensitizing Max to them. For example, pick up the keys, but then sit down to show Max that nothing negative happens after these cues. Gradual desensitization. Begin by leaving Max for short periods, rewarding calm behavior when she returns. Gradually increase the time apart, provide enrichment, introduce puzzle feeders or safe chew toys that distract Max while Sarah is away. Professional help. If Max's anxiety persists, Sarah might need a behavior consultant or veterinarian to assess underlying causes and recommend medication if necessary. By consistently following these steps, Sarah can help Max build resilience to being alone, reducing anxiety and destructive behaviors over time. Compare the use of crate training versus enrichment strategies in managing a dog's destructive behavior. What ethical considerations should be taken into account? Answer: crate training is a common technique to prevent destructive behavior by confining a dog to a secure space when unsupervised. This can prevent chewing, digging, or accidents. However, it should not be used excessively or as a form of punishment, as it can cause emotional distress if the dog is left in the crate too long. Enrichment strategies, on the other hand, focus on meeting the dog's mental and physical needs. This can involve puzzle toys, scent games, or other activities that engage the dog's mind and body. Enrichment reduces boredom and frustration, which are often the root causes of destructive behavior. Ethical considerations. Crate training should never be a substitute for proper exercise and stimulation. Dogs must have adequate time outside the crate for socialization and physical activity. Enrichment activities must be appropriate to the dog's age, ability, and interests. Overstimulating a dog with too many activities can lead to stress. Ethical practice requires balancing management techniques like crate training with enrichment to ensure the dog's well-being. Discuss the role of socialization in preventing fear-based behaviors in dogs. Include examples of structured socialization practices. Answer: Socialization plays a critical role in preventing fear-based behaviors by helping puppies develop confidence in different environments around other dogs and with various people. Early exposure to new experiences in a controlled and positive manner reduces the likelihood of fearful responses later in life. Structured socialization practices include puppy classes where puppies are introduced to controlled positive interactions with other puppies and adults, controlled exposure to a variety of environments such as busy streets, parks, and car rides, gradual desensitization to common stimuli, e.g. vacuum cleaners, loud noises, paired with positive reinforcement. These practices ensure that puppies learn to associate new experiences with safety rather than fear. A puppy exposed to new things at a young age and in a positive context is more likely to grow up confident and adaptable, reducing the risk of fear-based behaviors. How can counter-conditioning be applied to address leash reactivity in dogs? Answer: Leash reactivity occurs when a dog reacts aggressively or anxiously towards stimuli, e.g. other dogs, while on a leash. Counter-conditioning is an effective strategy for changing this emotional response. Identify triggers. Observe at what distance the dog begins reacting to other dogs. Start training at a distance where the dog remains calm. Pair with rewards. When the dog sees a trigger, another dog immediately reward calm behavior, e.g. treats, praise. This builds positive associations with the presence of the trigger. Gradual approach. Over time, reduce the distance between the dog and the trigger while continuing to reward calm behavior. Eventually, the dog learns that calm behavior leads to positive outcomes. Counter-conditioning helps the dog associate previously stressful stimuli with positive experiences, reducing reactivity. What is the significance of puppy classes in the socialization process and what characteristics define a high-quality class? Answer: Puppy classes are crucial for teaching puppies appropriate social behavior and building confidence in unfamiliar situations. They provide structured environments for puppies to interact with other dogs and people, fostering positive social skills. Key characteristics of a high-quality puppy class include small class sizes to ensure individual attention and control, positive reinforcement methods to reward desired behaviors, supervised interactions to ensure puppies are not overwhelmed, age-appropriate curriculum addressing key developmental needs such as basic obedience, play behavior, and bite inhibition. High-quality classes should focus on building a puppy's confidence and social skills, laying the foundation for good behavior throughout their life. How do environmental factors influence aggression in dogs, and what steps can be taken to mitigate aggressive behaviors? Answer: Environmental factors such as lack of exercise, poor socialization, and stressful situations, e.g. overcrowding, unfamiliar people, or animals, can contribute to aggression in dogs. Dogs that experience high levels of stress or frustration may react aggressively as a defense mechanism. To mitigate aggressive behaviors, increase exercise to help the dog release pent-up energy and reduce frustration. Socialize the dog with various people, animals, and environments from an early age. Provide a stable environment with clear boundaries and routines to reduce anxiety. Positive reinforcement training can help redirect aggression into acceptable behaviors. By addressing the root environmental causes and using appropriate training techniques, aggressive behaviors can be significantly reduced.